feeling confident and dressed for success. Speeches have been something that you've always done. You walk into the stage in front of many people, and all of a sudden you have butterflies in your stomach, your hands are clammy, you have that stared deer look in the headlights, your mind goes blank. What do? According to the National Disorders page, anxiety disorders are the most common mental illness in the United States. It affects 40 million adults in the US age 18 and older, which is 18% of the population. Anxiety is a mental illness that is a hidden disorder that people may suffer. Anxiety disorders develop from risk factors, so knowing that your triggers are identifying the symptoms that may help the treatment plan. According to the webpage Anxiety and Depression Association of America, updated August 2016, anxiety disorders develop from a complex set of risk factors, including genetics, brain chemistry, personality, and life events. An article wrote by Rick Newhart, a genetic disposition for anxiety, wrote in 2015 that scientists discovered a particular genetic variation that is linked to being inhibited or introverted, and it also is associated with increasing activity of brain regions, including emotional processing. We found that the variations of this gene were associated with shy, inhibited behavior in children, introverted personality in adults, and the reactivity of the brain regions involved the processing of fear and anxiety. Each of these trait factors appear to be a risk factor for social anxiety disorder. Anxiety and personality are linked together, according to William Meek, Anxiety and Professionally Style Anxiety as a Disease or Other Emotions, updated February 3rd, 2016. Exploring how a person first learned to deal with the world can also uncover contributing factors, being taught directly or indirectly how to deal with the relationships, work, or the future, whether being anxious produces a successful outcome. This shows anxiety can be taught as a personality trait. Traumatic experiences such as divorce, a job loss, somebody that's been abused or neglected, a death of a loved one can cause anxiety. Even things like genetic, lifestyles, and personality are common reasons for anxiety. Recognizing many symptoms and the lasting effects of anxiety have been important to be aware of. So, according to the Mayo Clinic, the common symptoms of anxiety are feeling nervousness, restless, or tense, having a sense of impending danger, panic or doom, increased heart rate, breathing rapidly, or hyperventilation, sweating, trembling, having trouble sleeping, having difficulty to worry. Worrying does not seem to go away on its own. Anxiety disorders are high treatable, although only a third of the people get treated for them. The life of something suffering with generalized anxiety disorder is plagued by constant state of worry, fear, and dread. It is stated that Timberline Knolls Residential Treatment Center article on anxiety symptoms and effects dated 2016. Feelings of being overwhelmed during episodes is completely controlled by one's feelings. Chronic anxiety disorder frequently occurs alongside eating disorders, bulimia, anorexia, drug use, even as far as self-mutilation. Some tend to try to self-medicate by using alcohol and drugs, even as far as self-mutilation. Often we tend to ignore or put off doing proper treatment we need in order to live a healthy lifestyle. According to Insight, and Outlook, Treatment Plans Overuse Anxiety, updated in 2016, there are major goals that you should set as increased understanding of anxious feelings, correct irrational thinking, improve coping with anxiety and anxiety symptoms, improve insight, and reduce vulnerability. Increase the understanding by identify the clues and symptoms, develop a vocabulary to describe anxiety and fears, knowing the triggers and the areas of vulnerability which underlies anxiety, improve coping with anxiety and its symptoms, learn relaxation techniques to reduce activity, although stopping, thought twitching, creative visualization, progressive made relaxation, and keep breathing. Deep alternative responses to substitute for past coping choices. Increase the understanding and the pattern of the cycle of the behavior leading to acting out. Challenge irrational thoughts with reality. So today we have discussed that the hidden mental illness of anxiety affects 18% of the United States population. We examined the risk factors of anxiety, then we covered identifying the symptoms and the effects of this mental illness that can do to the effects that this mental illness can do to you. Finally, we conversed major goals of controlling and overcoming anxiety by understanding anxiety to the full extent and treating it properly, whether it's through identifying the symptoms or medication. It'll allow you to control your anxiety and your anxiety not to control you.